how often do you see patients with gastrointestinal diseases?
You mean cancers, right?
Cancers, yes.
At least one or two new patients every week with either colon cancer, any of one of those subtypes in the gastrointestinal, and then we see a lot of follow-ups because half my cancer patients have gastrointestinal cancers.
Okay. Um, uh, how do you feel the pancreatic cancer patients differs from normal non-cancer gastrointestinal diseases?
You mean from other cancers also?
Well, from other gastrointestinal diseases, not just cancers.
Well, the cure rate for pancreatic cancer is pretty poor. So, most of the other gastrointestinal diseases, as well as most of the other cancers of the gastrointestinal tract, like colon cancer, has a much high cure rate, especially found in the early stage. Whereas in pancreatic cancer, even if you find it in stage 1 or 2, the cure rate is still not that great at all.
I think it's about 18% survival rate in the locally advanced stage.
Exactly.
And I think it's about 2% in the
Metastatic, yeah.
Metastatic stage.
Yeah, so plus the amount of time they survive also is much shorter. Most of the metastatic pancreatic cancer, 6 months if it's metastatic, is what we see. Whereas in colorectal cancer, even if it's widespread, a lot of people live 2 to 3 years, even in the advanced stage. So there is a lot of problem with early detection, and even if you find it, hard to cure, and things like that. So we need to make a lot of progress there.
What kind of research is there in West Virginia about treatment for the disease? Do you know of any?
Well, in the clinical setting, we have a couple of studies that is kind of done in conjunction with the surgical oncology department here, Dr. Magesh Sundaram. He's trying to do a different approach to shrink the cancer a little bit before surgery with some chemotherapy. So that's the newest thing we are trying now. And there are some basic science researches going on, probably not specific to pancreatic cancer, but a lot of cancers do have similar pathways and all that. So.
Okay. As a doctor, if you found a patient with pancreatic cancer with the localized form of the disease, would you feel confident in their survival?
Well, it depends a lot on their performance status and their other medical conditions. If somebody is very healthy otherwise, no history of alcoholism or chronic pancreatitis or something, and they respond to treatment. We had patients who went 2 to 3 years, fairly asymptomatic on that, but it's very hard to cure if it's not curable by surgery, which is the usual surgery, is the Whipple procedure.
Okay. I want to get now to the focus of our piece. It's difficult to find the early symptom signs. Are there any known pancreatic cancer early symptom signs? Any definite?
Well, I don't know if it's entirely we can limit it to the early stage. Overall, pancreatic cancer is a harder cancer to detect in the beginning because it's most often asymptomatic. If an adult patient develops diabetes out of the blue, that sometimes a telltale sign that maybe it could be one of the early signs of pancreatic cancer, even though a lot of people develop adult onset diabetes. So the proportion of patients who actually have pancreatic cancer among them is still low, but that's one that's getting more recognized as could be a telltale sign. A lot of the times patients have pain, weight loss, jaundice because of some blockage, but usually by that time it's a little bit more advanced.
Okay. Is there a known, is there a known cause for the disease? Do we know where it comes from?
Not really as a separate entity. However, anybody who has a lot of inflammation in the pancreas from chronic pancreatitis or things like that, any inflammation can always predispose to cancer development. So.
One final question. Do you see any hope for cure, better treatment in the future? Do you have confidence in any research?
Definitely. Even in the last ASCO meeting, that's our national oncology meeting, there was a new study on pancreatic cancer where they were trying a new combination of chemotherapy in advanced pancreatic cancer with oxaliplatin and all. A new regimen that actually prolonged the survival by 3 to 4 months. So that was one of the big major steps we did, we obtained in pancreatic cancer in the recent years, because a lot of the previous studies never made a more progress than an extra 2 weeks or 3 weeks, but this was in terms of few extra months, and I think that is a step in the right direction.
Okay, and I'm sorry, just one more question. In your own words, why do you think it's so difficult to detect, to not be able to diagnose it so early?
Well, that comes true of a lot of cancers that are inside the body as opposed to breast cancer or something you feel outside. Same is true for ovarian cancer and all that, because once they're inside the body, there is a lot of space for them to grow without causing a symptoms, and then you don't feel it outside, so that the detection is probably only done once it starts pressing on something or causing some kind of symptoms. So it's kind of true for a lot of intra-abdominal cancers that detection is hard, which is different in colon cancer because we have a colonoscopy that we do, whereas there is no real good screening for some of the other cancers.
Okay.
And as a whole, I think pancreatic cancer cells are resistant to a lot of the chemotherapy. The inherent nature of the cancer cell is a little bit resistant, with a high rate of resistance to a lot of the agents we try. So it's not only to treat.
To kill with the chemo?
Yeah.
Okay.
Not only hard to detect, also hard to treat.
Okay. Well, thank you so much.
All right, thank you.